So some of the common complaints that we see in patients presenting to the emergency department include chest pain related complaints like heart attack, congestive heart failure, respiratory complaints like asthma exacerbation, pneumonia, COPD exacerbation, abdominal pain related complaints like diverticulitis, gastroenteritis, appendicitis, neurologic complaints like seizures, stroke, TIAs, and mental health related complaints like anxiety, depression, and substance abuse. At the current time, there are multiple treatments for COVID-related symptoms. For patients that are not sick enough to be admitted, the treatment includes monoclonal antibodies. This is an infusion that the patients receive when they present to the emergency room. The patients generally have symptoms of shortness of breath, respiratory-related symptoms, body aches, loss of taste and smell. For patients who are severely ill that require admission, they tend to be hypoxic. Their oxygen level is low, and they end up getting admitted and receive convalescent plasma, remdesivir, amongst other supportive treatments. Since the beginning of the COVID pandemic, the care has evolved and followed current public health recommendations. All staff are required to wear masks. Patients and their family wear masks when they visit the hospital. Besides that, patients are screened with COVID-related symptom questions, and their temperatures are checked when they arrive to the emergency department. Besides that, the rooms are cleaned using strict cleaning protocols to ensure that patients and staff are not exposed to the virus. The patients who receive coronavirus testing include those that require elective procedures, as well as patients admitted to the hospital and those requiring surgeries. Besides that, patients who are exposed to someone with coronavirus and present with any COVID-related symptoms. Some of the effects I've seen in delay of care is that the patients are coming to the emergency department much sicker. They are later in their course of illness. They have disabling injuries, and unfortunately some of them have died because of coming into the emergency department too late. Recently I took care of a patient who had stroke symptoms for several days. Instead of coming earlier, he delayed his care because he didn't want to come to the emergency department and catch COVID. By the time he came, we recognized that he had a stroke. We admitted him, started him on medication, and also consulted a neurologist. Unfortunately, because of his delay in care, he had some disabling features such as slurred speech and facial droop. Had this patient come in earlier, he would have had more treatment option, and he would have had a better outcome, which would have prevented more disability. Patients should come to the emergency department when they have symptoms like chest pain, shortness of breath, tingling, numbness, or any symptoms that does not feel right to them. If they're unable to see their primary care physician or utilize telehealth, we're happy to see these patients. My inspirations for emergency department occurred during my medical school rotation. I really found the career enriching and rewarding. I really feel that I left a long-lasting effect on patients when I treat them acutely and see them improve. On top of that, we get to see patients of all ages. We see young patients like newborn to our older population patient. And I find that with emergency medicine itself, we see the largest number of medical condition of all the specialties. My take-home message for not delaying care is that we're here to serve our community. A lot of times people see their mild symptoms as something that's going to pass, and unfortunately some of the times this doesn't happen. As a result, they come to the emergency department sicker, with disability, and sometimes death because of delay in their care. The hospital has taken huge stride in protecting the public, protecting the staff, protecting the family, and as well as the patient. We're here to serve the communities of the San Gabriel Valley.